Hello, I'm Assesment, and on this presentation, I'll be talking about El Paso County Community Health. On this slide, I'll be talking about the county demographics. As far as basic information, El Paso County is considered a metropolitan area, with our population being 880,000 as of 2025. As far as basic, we have the health and well-being above state and equal to national average. But as far as our community conditions, our community health, we are below state and national average. On the following slides, I'll go more into detail. This slide is more of a visual representation of the previous information I just gave. This comes from the County Health Rankings webpage. And as you can see, with El Paso County's population, when it comes to health and well-being as of 2025, we're pretty much at the national level and a bit above the state level. But when it comes to the El Paso County conditions, we are below national level and state level. So there's a few things that contribute to this. On this slide, I introduce a bit about the demographic breakdown. As far as El Paso, Hispanics are the majority of the population. As you can see, there's 82.8% that are Hispanic, 11.1% that are white, 3.5% that are black, and the remainder 2.6% are either Indian, Asian, or Pacific Islanders. And this is only as of 2025. This is only what was recorded during the census. Obviously, there can be those outliers that never reported that they live here, or just, possibly people that moved in, like maybe in the middle of the year. So there's a little bit of leeway there. On this slide, I'm going to go a little bit more into depth when it comes to the population and health and well-being of El Paso County. As you can see here, we have a chart that signifies the causes of death of 2025. But if we focus on the years of life lost before the age of 75, El Paso County is well below state and national averages. There was an estimate of 7,600 years of life lost before the age of 75, and that's only in El Paso County. When we go to the leading causes of death in El Paso County, we have COVID-19 still being the number one cause of death, with 2,180 deaths. In second place, we have malignancies with 1,968 deaths, following along with heart disease, 1,609 deaths. And after that, we have accidents at 922, and following along would be liver disease at 603. So here on the chart, it just illustrates which ones have been the leading causes of death, which more than likely you wouldn't think that COVID is still a cause of death here, despite COVID-19 and starting in 2019, but it still has a huge impact here in this community. On this slide, we talk a little bit more about the health status of El Paso County. So this one ties into a little bit more of the years of life lost on the previous slide. So here the life expectancy would be 77.7 years compared to 77.2 state and 77.6 national. We're slightly above both of them, which is a great thing, and this is only the average. When we talk about mortality, when it comes to premature mortality, we have about 400 per 100,000. When it comes to child mortality, we have about 50 per 100,000. And on infant mortality, we have about 5 per 1,000 infant mortalities, which is no difference than the state or national level. When we talk about quality of life, the people have reported there is poor physical health. And they reported 4.6 days per 30 days of poor physical health compared to 3.8 state and 3.9 national. So the quality of life is a little bit more poor, but it's more about physical health. And then to an addition of the quality of life, 15% reported physical distress compared to 12% state and national, which means about 14 days or more per 30 days. That means they were either in poor health or physically stressed out for about half a month or more. And then on top of that, we have 16% of the population living with diabetes. And when we talk about, or when we compare it to state and national levels, we're well above that, with state being 13% and the national level being 10%. And the huge concern here in El Paso, Texas, is that 39% of our population is considered obese. We're not very far off from being 50% of the population being obese. When we compare it to state, we are at 36, and then the national level is 34%. Obviously, we're above that, and that is something that is concerning, and the numbers are going up slightly. Now we talk a little bit about the healthcare access that's available here in El Paso, Texas. So when we talk about patient to primary care provider ratio, we are at 1,860 patients per provider, which is very well above the state, which is 1,640, and the national level, which is 1,310 per one, which is significantly higher. When we talk about patient to dentist ratio, we are at 2,020 per dentist. As far as the state, it is 1,580 per dentist, per one dentist, and the national level is at 1,340 per one dentist. When we go to mental health providers, which is a big thing because mental health is a real thing, and it's something that impacts El Paso County. We are at 650 patients per one provider. When it comes to state, we're not too far off, which is 550, and the national level is 290 patients per mental health provider. Another thing here to address is that 23% of the population is uninsured, and this is only as of 2025. There's a slow decline, so though that percentage is going down, which is a good thing, but we're still, compared to the state and national level, we're still way above that. We have the charts next to this information showing how the percentage of people uninsured dramatically dropped. We were almost at 40%. And right now, we're about half of that at the moment. And when we talk about preventable hospital stays, we're pretty good at that. Compared to state and national levels, we're below. So we're at 2,060 preventable hospital stays per 100,000 patients, compared to state, which is at 2,968, and national, which is 2,666. On this slide, I would like to address the healthcare facilities, the types of facilities that are available here. So in total, according to the AHD.com, we have 17 total healthcare facilities, one being a children's, one being a psychiatric center, 2 being behavioral, 2 being specialty hospitals, 3 being rehab hospitals, and the remaining 8 are medical centers. This is not including freestanding EDs or urgent cares. As far as the public health program being proposed, this program would be more of a with or without insurance. You don't have to have insurance to join this program. And what I'm proposing is discounted gym memberships or fitness memberships to anything available, preferably close to their homes, and also free consultations to dietitians and meal plans. It's like this would benefit, and the ones eligible for this program would be those that have underlying health disease, chronic diseases, prediabetes, diabetes, hypertension, anything that has a predisposition to their health. I also wanted to include people with BMI of greater than 30. In the article In BMI We Trust by Ilya Grudin, she talks about how it provides an understanding not of the individual but a sociological feedback, a social construct, and to demonstrate evidence-based medicine. So she uses this as more of a tool, not for an individual, but an overall gauge of public health. And that's what we're seeing in this information. We are gauging the public's BMI as a percentage. And also, in the article Quality of Life and Diabetes by Richard Rubin and Mark Payrot, they express the challenges of people living with diabetes, that it's not only just a physical challenge, but it's also a psychological challenge. If you could only think that every day that they have to keep pricking their fingers, checking their glucose, and making sure they're okay. And this is on their everyday lives. By implementing these programs and available to these types of people that have predispositions, they have chronic diseases and prediabetes, hypertension, diabetes, and furthermore, these this program will be beneficial to the public health. It will also be beneficial to the individual. They're going to see a greater quality of life. They're going to be motivated to go to the gym. And we could discount the gym prices about 25%, which is pretty appealing to most of the people here in El Paso, especially seeing that the cost of living is going up. The cost of living does not have to have an impact on your health. As far as dietitian access, management with diabetes and weight loss, as far as weight management, is also part of the program. But overall, the activity of the community will be greatly improved because all of this is being offered to them with or without insurance. It doesn't have to cost them anything. And it's just a discounted gym membership. As far as the engagement, we have physicians, dietitians, and hospitals being our main focus here. When it comes to physicians, patients can have a greater quality of life, which means physicians have healthier patients. Routine checkups could be more frequent or less frequent. Somebody that has a chronic disease can get checked up more routinely, and as they have a healthier lifestyle, then they just continue checking up and making sure, hey, I'm healthy. As far as dietitians, they're able to provide these patients with meal plans and workout routines and healthier life choices. And when it comes down to the hospitals in this region, you will more than likely have less admissions, less ER visits from possibly patients that maybe ran out of insulin. Maybe they'll have less ER visits because they can't manage their glucose levels. But this program will help them because they're able to join the gym, they're able to join fitness memberships, they're able to have access to dietitians that can help them along the way. So overall, this is something that can benefit the entire community. And as far as community engagement, the only beneficiaries here would be the individual, would be the community. They're going to have a healthier life. They're going to have healthier lifestyles. They're going to have prolonged lives, like we're seeing now, an upward trend of an extended life.